Welcome to HRG's Revenue Cycle Review podcast. Thank you for joining us.
The mission of HRG's podcast is to educate, discuss revenue cycle topics, and interview healthcare leaders.
Together, we hope to provide our community with contemporary information and feature industry leaders on a bi-weekly basis. We're your hosts, Danae
and John Gibson.
Thanks for joining us for the HRG Revenue Cycle Review. Today, we're going to be discussing expanding your revenue cycle beyond the office walls. And joining us is Jennifer Collier, the Vice President of Revenue Cycle with Christus Health. Jennifer, do you mind taking a moment just to introduce yourself and sharing a little bit about your role at Christus?
Sure. Thanks for having me, John. I appreciate you letting me join the podcast. As you mentioned, I'm currently the Vice President of Revenue Cycle with Christus Health for the Northeast Texas region. We are based out of central Northeast Texas, out of Tyler, and we have a satellite office in Longview and Sulphur Springs as well. I currently oversee the back-end revenue cycle for 5 hospitals and approximately 450 physicians.
Wow. So a really big foothold in Texas. Are they all in Texas, I presume, all the facilities?
Right now, under my scope, yes, they are all within the Texas region. We do have facilities throughout the state and a couple of other areas, including other countries and other locations, but I'm currently working within the Northeast Texas region, although the physicians span across the entire state.
Wow, huge undertaking, especially in a time of crisis, really, right? The world's changing every day, and I think we're all trying to find our new normal. And with that intent, Danae, I know that you have a lot of insights and kind of as it relates to sharing your thoughts around expanding the revenue cycle walls. And, do you have any questions that you'd like to maybe offer, kind of contribute here to Jennifer as well?
Yeah, and I really, of course, I have 1,000 questions because,
Sure.
I worked in the revenue cycle on a smaller scale in critical access hospitals, so I can't imagine the difficulties, in a position having that many organizations reporting to you. But related to the crisis, what has been your biggest challenge as it's relating to engaging your revenue cycle staff?
So one of the biggest challenges was we were currently not set up with remote employees, and we had to go very quickly from a remote office that had a large number of employees in a small footprint of a building and take the majority of those and transition them to remote quickly. Where I've worked in the past, we have had up to 60% of our staff remote. So luckily, there was some background information that I was able to use to help make that transition. But for staff who had never worked remote, staff who were trying to juggle personal things going on with children, not being in school, trying to figure out, did they have the right kind of internet access at home? Did they have a secure place to work? And then people just in general worried about the health of the organization. Was the organization going to survive the cut in revenue services as all non-emergent services had to stop? A lot of people were concerned about the longevity of their position, all while trying to continue doing their job in a new environment, but continuing to make a big financial impact for the organization.
Sure. And so I'm sure that you, with your background, have had a lot of good insight on moving forward with a plan like that. And so I guess if you could say, what the first step was to transition those employees to remote employees, what would that be? And I agree with you as far as moving staff from their current environment to working remotely. I've experienced this myself. So I guess back to my question, what was the very first step in transitioning people?
So the very first step we had to do was determine the technology and the access issues. So when I think about taking a large workforce that's based in a building and having to move them quickly to remote, there's kind of 5 key elements in my mind. So there's technology, which includes everything from hardware to software to server access. There's patient private information and security. So how do you ensure that PHI is protected while they're working in an environment in the home? The third is productivity and quality monitoring. Then that's kind of your immediate to get things going in a quick turnaround time like we experienced with the COVID crisis. When you have more time to plan it out, these next two steps can be done kind of in advance as well. For us, some of that's being built right now as we're adjusting to the environment, and that's your employee engagement and then your policies and procedures. But no matter which way you're doing it, whether it's something that's well thought out in advance and you're executing it in a rollout, or if it's something done in response to a crisis, you have to set clear expectations for the staff, for your leaders, because it is a different type of working environment, and it's something that they need to understand what is expected of them, and they need the tools and the technology to do it and continue doing their job effectively.
Sure. So I'm thinking about all of those things and how challenging it is to put a plan like that together, especially in crisis mode. And with the organizations experiencing all sorts of difficulty now related to revenue, related to quality, related to patient safety, staff safety. At the end of the day, you have these people in place that have jobs to do. So something I'm wondering, during this time, how are you guys ensuring productivity of your staff?
It's really funny because when I talk about remote workforces and setting them up, one of the very first things I usually get asked about is productivity and quality. And right now, you have a bunch of external factors that are impacting it too, such as kids having to be homeschooled and people worried about just general safety of leaving their homes and how are they going to get groceries, et cetera. But really, at the core of it, working remote is not new to healthcare. A lot of people with the back end revenue cycle, it's new. But think about coding. Coders have been working remote for well over a decade because they had to, because there was a shortage of coders. They didn't have an option, and they had to figure out how to make it where employees could code remotely. And so for them, this is all commonplace. This is what they do. And so now, as you look towards the back end, I always like to try to remind people, well, how do you monitor their productivity and quality while they're in the office? Just because they're in the office, how do I know they're doing their work, right? It doesn't
Right.
matter to me if they're sitting in a cubicle down the hallway or where I can see them from my office. How is that any different than when they're sitting at home? Either way, you have to have reporting that's going to give you the productivity numbers, and you're going to have the QA measures for quality that you would have on a normal basis. And the interesting thing about productivity and working remote, HFMA will tell you that best practice standard is having higher productivity for your employees who work remote. My policies have always included about a 15% higher productivity standard when they're working from home. And we found even in this crisis, while people are juggling all these other external factors, our staff are exceeding their normal productivity by about 25% right now by just
Wow.
moving them from the office to the home. And a lot of that is, yes, there are interruptions at home, but you eliminate all the interruptions in the office. I call them the water cooler discussions, right? So people stopping by, asking how your weekend was, commenting on your shirt, oh, let's stop by the break room. At
Yeah.
home, you might have a few interruptions with, the mail delivering or letting the dog out, but overall, there is less time that you're pulled away from your desk. And when you're working a productivity-driven position, such as billers, collectors, posters, they can actually produce at a much higher level when they're in that focused environment.
Sure. Yeah. No, I like your comparison to coders being at home for a long time, and how is this any different? So I appreciate your insight. That was great. Thank you.
You touched on the reporting and monitoring of productivity and setting expectations, but due to the crisis and the world of COVID, what do you do specifically to address the decline of revenue? What are you doing to kind of combat that?
Obviously, that was something we had to react to very quickly. Within, mid-March, when the governor closed down unurgent procedures, we were already seeing a lot of cancellations, outpatient procedures, diagnostic testing, and interestingly enough, emergency room visit volume is down very significantly. And a lot of this is not just due to people avoiding the virus, but bars are closed, teenagers are not driving, people are not going places, so there's less trauma, which overall isn't that great for you don't want to wish anybody to get sick or injured and end up in your hospital, but it did create a very large revenue shift. One of the things that we've done is take this time to really analyze and look at where are backlogs, where are pockets of AR or unbilled accounts that we're backlogged on. I don't know any revenue cycle shop in the US that doesn't have a backlog somewhere, right? There's always openings or, time. There's never enough time in the day, right?
Right.
So one of the things that we really stress to our team is that, this is our opportunity to really contribute to the mission of the organization in a really unique way. We're always striving to bring in money for the organization so they can continue doing the work with the patients on the front line. And now we were able to say, hey, this is even more important right now because we need these funds in order to get the organization through the crisis period. And so that's what we've been doing, turning over every stone, looking to see what we can do to collect on old accounts that maybe were previously denied, or maybe they were hung up in the system due to something, and really just getting our accounts receivable as clean as possible.
Fantastic.
That's amazing. That's an excellent strategy.
Absolutely. Especially in light of the fact that your productivity has increased 25%. So you're making, lemonade out of lemons. Wow, I really like.
Exactly. That's our goal. So far, it seems to be working pretty well.
Sure. So what has given you and your organization sort of hope during this time?
I think that our organization responded really great to the crisis by just communicating with us continually and keeping us updated. We do still have some staff that are coming to an office. There are a couple of positions that were not able to go remote either due to no internet in the employee's home, or maybe their particular role includes a patient privacy function that just cannot be moved out of a physical office. And so for those positions, they're still coming to an office, and the organization has taken great strides to ensure the staff are safe. Even though we are not located on the clinical campus of the facility, we're in a off-site building that just houses some of the business office and other support services. They have been treating us as if we're a clinical location. So we receive employee screenings in the mornings, just like they do at the hospital. Yeah, masking and, visitation restrictions and things like that. And I say that, all of that helps give the employees comfort that they're being taken care of. And then the hope part really just goes back to what I said about the mission of what we're doing. So, the frontline staff here, they're the heroes who are providing the care every day. And as revenue cycle folks, we all the time try to connect the dots, to our staff sitting here behind a computer. We always try to connect the dots back to what you do every day means we get to go out and do more of this mission. That's what we're trying to really stress through this time is look at the value you're bringing. And so I think, our region hasn't been hit as hard as some other densely populated areas, but, we do have offices in major metropolitan areas like Dallas and things like that. So there have been some areas impacted more than other, but the fact that they're communicating and they're treating all of our locations the same with the same precautions, the same safety features, and just continuing, we're letting the staff know about their successes, letting them know where they're making an impact, and that just, showing them the increase in their productivity. And that's been really encouraging to them to see, hey, look, this is an uncertain time, it's unprecedented, and I'm doing it. And I'm doing a great job, and I'm doing my part.
Right. Yeah, it's got to be empowering to them, certainly. To that end, do you have any maybe additional advice that you would share with other peers in Texas or even moreover just across the country?
One of the things I think is that I would really challenge people to think about how can a remote workforce benefit you and in the non-crisis situation. So I've heard some of my peers say, yeah, we sent everybody home, but I can't wait to bring them back. Or I've heard, them say, when are you going to start sending people back to your office? Because I'm trying to figure out, when I'm going to send them back to mine. And my challenge back is, do we need to? So we don't know what the future holds. We don't know the course of this and what will be coming. But even taking COVID out of it, this is actually a topic I've spoken on several times at some HFMA conferences where I was previously located. We 3 years ago, maybe 4 years ago, implemented a remote workforce program, and we saw a lot of unexpected benefits from it. Things we expected, right? There were things we expected, like, less office space and, the reduction in costs and then, increase in employee morale. But the unexpected benefits were tremendous and really solidified how the world is changing and people want flexibility. Working from home isn't for everybody. There are some employees that's not a good fit for them, but it works for a lot of people. It works for a lot of people with their family schedules. And I just challenge organizations, now's the time to rethink all of that. Reach out to people who have successful work from home programs. There are a lot of business offices that have shifted that way over the past 5 years. Look at ways. There's a lot of myths with people working from home, and I guarantee you there's an answer to solve every myth that's out there. Rather it's your question about productivity or security of patient information or how to keep the employee feeling like part of your organization versus just someone at home working. There's an answer to it all, and if we had a lot of time right now, I'd go through my thoughts on all those, but I won't bore you with that today. But I'll just tell you that now's the time to think differently. And if there's something you've always wanted to do, but you didn't think the organization was on board or ready for it, this crisis could be seen as an opportunity to get some of those things accomplished and implemented.
Right. Yeah, I agree. And I love your optimism. I think it's fantastic. And what a great challenge to your peers. Thank you so much, Jennifer, for sharing your insights and joining us on the Revenue Cycle Review. I'm John Gibson.
And I'm Danae TG.
Thank you for tuning in.